replacement therapy, Commissioner of the FDA, Marty Makary, has a piece in the Journal of the American Medical Association, JAMA, and also, I believe, in the Wall Street Journal,
What's journal? Yep.
in which they're announcing the removal of a black box warning for hormone replacement therapy for, I guess, pre and peri and postmenopausal women. The pendulum had certainly swung way, way far away
Yeah.
from patients receiving these treatments, and including many people who had almost no risk or for whom the benefits were really, really substantial. So I think that this is probably progress.
Yeah.
Um, but I'm
Oh, yeah.
wondering whether you think that zooming out, whether this is the kind of thing that Commissioner McCary is thinking about in his personal deal with the devil, so to speak, meaning he's willing to stand next to RFK while he spouts nonsense about various hobby horses that the secretary has, and that Dr. McCary knows better and plays along with that so that he can go and then do something like this, which honestly, why hadn't it been done up until now? So he might believe that it's worth the risk. Do you think that A, that is what's driving somebody to serve in this administration, a moment like this? And B, do you think that the misinformation that is coming out of HHS and on other topics makes news like this less easy for people to
Uh-huh.
believe,
Yeah.
even though it might very well be good guidance?
That's an interesting question. So first of all, I am completely for this change in guidance. When friends of mine who are going through menopause ask me what should they do, I will say unless you have breast cancer, where it's contraindicated or, something like that, I will say hormone replacement therapy is the best option. In terms of how does he think about his role in the administration, I can't read his mind. I can only speak to what I know of other people who have served in administrations where they did not agree with everything that administration stood for, whether it's Trump or Biden or whoever. And I think a lot of people believe it's a really important platform, FDA commissioner, for example, to change things for the better. And I think some people are perhaps a little Pollyanna about what they'll be able to do and not do. I would say most people actually are, because I think the cachet, perhaps, the prestige of some of these positions,
No.
and thinking that you're different from anybody else. You can't be sullied in the same way others have been. You won't have to compromise in the way others have had to. I think there's a lot of egotistical sort of thinking there that somehow you'll be exceptional and it won't happen to you. And I
Yeah.
think it's somewhat delusional. But there are some things you can accomplish even in an administration where you're not completely on board with everything.